Health Reform Explained TV, the governor of the great state of Nebraska. How are you, Governor? How'd the state of the state go?
I'm doing great. The state of the state went great. We're focused on growing our economy, creating more jobs, opposing Obamacare's Medicaid expansion because it's too expensive.
Why? Can you talk to us a little bit more about that? We visited, and you'll have to check out our interview on America's Healthcare Challenge, but the economics behind that decision?
It is really all about economics. When you get right down to it, Obamacare's Medicaid expansion is too expensive because it would take future funding away from the education of our children here in the state. Secondly, the federal government's $17 trillion in debt. They're not going to come through with their promise, and so that'll put more expense on our side here in Nebraska, and that's why I'm opposed to it. I believe the focus of healthcare ought to be on making healthcare more affordable through wellness and prevention.
Can we talk about that a little bit more? And what are you seeing from the small businesses around the state as they grapple with this issue?
They're very, very concerned about the cost of healthcare. They want to provide their employees healthcare, but they've got to have a plan that's reasonable. Obamacare has increased healthcare, and the costs keep going up. Remember, they said if you like your current healthcare plan, you can keep it, period. Well, that's not true. He said it would reduce your insurance premium. That's not true. They need to slow down and get this right.
Let's talk about state flexibility, because it really seems like some of these problems can be solved at the local level. Care to comment on that?
Absolutely. If you give the states flexibility, we will find solutions that make sense for Nebraska. New York will do it differently. Massachusetts, I understand that. I have no problem. Let New York do it its way. Let Nebraska do it our way. Our demographics are different. Just look at our geography. I mean, take a state like Rhode Island, very small state in terms of geography. We're 450 miles long. We need a different healthcare system with greater flexibility, especially for rural Nebraska.
All right, final question. You hit on the prevention, and I think part of that's a healthy diet. So what's your favorite healthy meal when you're eating at home?
You know what? My favorite healthy meal, a good Nebraska steak with good salad and fruit, and you'll be in great shape.
That's Governor Dave Heineman. Thank you so much for your time.
You're welcome.